involved now for 2 years, and we've referred lots of patients. I know the worker we have, Rosina, here is offering services on a weekly basis, and we've referred people on who have specific issues, for example, financial requirements, problems with employers, needing help with sorting out appeals against Department of Work and Pensions, a lot of issues which we appreciate are important to them, but equally we can't give them too much time, because we only have 5 to 10 minutes with a patient, and we can't sort out all their problems for them. And we refer them on to Rosina, who then is available to spend, I believe, up to an hour at a time with them, and give them help. And we've had lots of excellent feedback, and she's very supportive. She has lots of ideas for them to take away, and she always liaises with us again. And if we need to have any further input, we're able to have that.
And considering the community we are in, I mean, we've really done well, and a lot of patients are there's too much demand, and I think Rosina's service is one which is really too much in demand, because, as I said, it depends on community. In a practice in a different area, it might not be that popular, but in this area, that is one service that is really doing well.
It has made a difference, and our patients will certainly support us in that. We've had, as I mentioned, lots of positive feedback, and people are happy that there is a service available. And we're not just saying we'd love to help you, but we really haven't got the time. And we have a service in the surgery, so they don't really have to go anywhere, and we're just able to book them in directly into the clinics, and we know that they will get looked after. So we feel that it's an extra pair of hands helping us to do what we can't provide to our patients. We've had people who've come back and said that the problems have been sorted out for them. It's made them feel better in themselves, and it's helped relieve their anxieties, and in some cases depression, which is precipitated or exacerbated by the social situation. And we feel that having this service has really made a difference to our patients' lives. We've been lucky enough to be involved so far.
And the added advantage, I think I would say, is that both the workers we've had, they both speak Asian languages, which is a plus, because in this community you cannot work if you don't know the languages. And because both the workers are really understanding, they understand the community, and they're from the same culture, that helps a lot. I think it all depends on the people who are actually imparting the whole service, because if the person, like Rosina, is not helpful, people won't come and see her, and same with Kudsia, if she's not motivating and she's not helping, people won't come and see her. So I think you've got good staff who actually do the programs. That's more important.
So,
Rosina's appointments. Earlier we used to have patients discussing all these benefits, and there are other matters in the consultation. Now, because GPs know Rosina's there, all they say is they give them an appointment or tell them to book with Rosina. So they're not basically spending too much time in their clinical session, as opposed to previously they didn't have there was no signposting, but now there's clear signposting. Rosina's available, they come in and see Rosina again, or for follow-ups as well. So that's one thing, and everything's on the computer. Anyone can go and have a look what they've done, what's been said to patient, what's been done. So it's all nice and documented.
So they all share EMI system?
We all work on EMI, yeah.
Okay.
As I mentioned, it's something which has made us realise that there are other things that we can do for our patients, quite apart from the medical, clinical side of things, and these social circumstances have a big part to play in our patients' medical conditions too. For that reason, it's something which I would be supportive of, and I'm sure the GPs would benefit from having this kind of service available to their patients in their surgeries too.
If you look at the difference when there was no health exchange, and if you look at now, obviously patients have a direction, and I think that's more important. Yeah, one-to-one, it's perfect. I can't think of any flaws in the program. It's a perfect program.